sit down and strap in because I'm going to tell you 7 things that the transgender community does not want you to know about gender reassignment surgery. Why? Because I pledge to be transparent and honest at all times on this channel, and that's what I'm going to do. When I refer to gender reassignment surgery or sex reassignment surgery, GRS and SRS, I am referring to the big snip or bottom surgery. Number 1, gender reassignment surgery does not fix and is not a solution to gender dysphoria. Gender dysphoria is something that you are going to experience throughout the entire length of your life as a trans person. However, at the same time, gender reassignment surgery can alleviate and lessen some of the symptoms of gender dysphoria. Now, I am not spewing out facts to scare you away from surgery because I myself am an advocate for bottom surgery and plan to get bottom surgery at some point in life. However, GRS is not a quick fix for all of your gender-related problems. If you are not at a place in your life where you are accepting of yourself with or without the surgery, then GRS can potentially make things worse when you realize it is not going to solve all of your problems. Number 2 is no big secret, however, it is underplayed a little bit, and that is the cost of GRS. GRS is sometimes referred to as costing anywhere between $20,000 and $30,000. However, there are a lot more costs involved in just the surgery. There is the pricing for aftercare, hotels, time taken off of work, revisions. This surgery is very, very complicated and very, very intense, and complications are very, very common. And when you have complications, you have to seek out revisions to correct some of those complications, and that costs money. Numbers like 20,000 and 30,000 are very big numbers, and when there are large amounts of money being thrown around, there are many scammers who crawl out of their cracks. So please be very, very careful when you are searching for a surgeon. It is very easy to buy fake plaques to hang up in the walls of an office. When you go to your surgeon for a consultation, make sure you ask for their certification information so that way you can go and look it up yourself and verify it. Do not take their word for it. This is a lifelong permanent surgery, and do not take their client's word for it or even your friend's word for it. Go look it up yourself. And just because they're not certified doesn't mean that they can't do the surgery. However, there are intricacies and many things that are very important to make sure they are done correctly. This leads me into number 3, which is a major common misconception, and that is that after surgery there is a chance you will lose the ability to reach your O or climax during intercourse. In modern practices for this surgery today, no major nerve should be severed. Therefore, you will still be able to reach your O after this surgery. Old practices are out the door and new practices are in. This is why it is very, very important to make sure that you are going to a certified, well-practiced surgeon who is up to date with today's modern practices. Now, that may be great news, but at the end of this video, I'm going to talk all about the anatomy and function of the vagina, so please keep watching. This also leads me into number 4, which is our rate of complications. For clients who have had the surgery, rates of complications such as strictures range from 25% to 58%. And fistulas range from 17% to 75%. These are only 2 of some of the common complications. Now, those are very, very large numbers, which means that complications are very, very high. The good news is most of these complications are quite easy to correct. Some of them do require surgical intervention. The 5th thing that no one is going to tell you about this surgery is that it is one of the longest recovery periods of any surgery. Now, on websites and maybe even what the doctor will tell you is that the recovery period is about 3 months. That is just the period of what it takes for your wounds to not reopen or cause serious harm to you. That is not the length of the full recovery period. Recovery for this surgery takes at least a year. The entire first year of recovery will be dedicated to dilating and ensuring that your new vagina does not lose depth or width. Like an ear piercing, when you get your ears pierced, you have to keep your earrings in for a certain amount of time in order to ensure that your earring hole does not close up. The first 3 months of this surgery are very gruesome. You are going to leak, you are going to smell, you are going to hurt, you are going to itch, and it is going to be very, very tiring, very, very discouraging if you are not expecting to experience what you are going to experience. Your surgeon is going to suggest that you don't have intercourse until about 10 to 14 weeks after surgery. However, most people don't even want to think about it at that point. Your vagina is going to be in no way, shape, or form ready for public consumption. Again, this is not to scare you away. This is only to educate you and enlighten you and let you know what to expect out of this surgery. This leads me into number 6, which is dilating. A lot of people don't realize that they are going to have to dilate going into the surgery, and if they do, they don't know exactly how strenuous and involved dilation is going to be. For the first 3 months of the recovery period, you are going to have to dilate 3 times every single day, and each time you dilate, it is going to be painful. There are numbing lubricants that you can use to help alleviate the pain, but this is something that you should expect and prepare for. From 3 to 6 months after surgery, you have to dilate once a day, and 6 to 9 months you have to dilate about once every other day, and then from 9 to 12 months you have to dilate once or twice a week as needed. Sexual intercourse does count as dilation, so if you are sexually active, you won't have to dilate as much. Now, why is dilation so necessary? Well, this leads me into my final subject, which is the vagina. As a transgender woman after surgery, your vagina is not like a cisgender woman's vagina. In cisgender women, the vagina leads to ovaries. However, as a trans woman, your vagina will not lead to anything. Therefore, it is commonly referred to as the vagina cavity. But as a result, your vagina will have to be cleaned way more often. Things will get trapped in there very easily, such as dirt and hair, and it will be much, much easier for you than a cisgendered woman to contract things such as UTIs. So therefore, it takes a lot more care for your vagina as a trans woman than as a cisgendered woman. Keep in mind that your new vagina will be a surgical wound and therefore will go through all of the healing processes such as any other wound, scabbing, pus, leaking, all kinds of things are going to happen that you are not going to be comfortable with. Swelling, smells. These are all things that you should expect and will go away over time. And again, there will be no sex for the first 3 months after the surgery. You will be able to masturbate very carefully, but know that intercourse is not advised until at least 3 months after. Now, again, I am an advocate for the surgery, and I am not trying to talk anyone out of it or scare them. However, this surgery is very scary. It is very complicated, and I absolutely have to be completely honest with as much information and detail that I have about the surgery. I hope this video was very enlightening and very useful for someone. If it was, please go and check out more of my videos. I post every Saturday at 2 p.m. and I look forward to seeing you guys in the next video. That's it for now. Ja!